Welcome, welcome, welcome. Wow. I love it. They were like, we're going to play Rolling Stones and you're going to come up. And I'm like, let's just do this. That's amazing. I'm fired up. Welcome to Fix Healthcare Live, the first iteration of Fix Healthcare Live, something I'm so excited about. In the audience, what's really fun to me is I see a lot of familiar faces, clients, partners, ecosystem partners who are doing great work with us. But I also see so many new faces, people that I've never met before, people who are coming into this movement, into this community over the last few months, and it is just so incredibly energizing. We have an incredible afternoon together, and I just want you all to give yourselves a round of applause for making it here through the traffic and all the headache and all this stuff. It's all you. It's a big deal. We're doing this. Before we dive in, I want to talk a little bit about why we're doing this. For us, so I believe that a movement is building. There are HR leaders, benefits leaders, healthcare entrepreneurs, digital health entrepreneurs, technology company founders that believe that what is going on in healthcare today is fundamentally broken and there's got to be a better way. You all are part of that community and part of that movement by the fact that you are here in this room. You care about that in some way that got you motivated to get on a plane, get in a car, get on a bus, and get out here. And so what Fix Healthcare is all about is how do we bring that community of HR leaders, technology innovators together to have the conversation, to move it forward and to build momentum around this Fix Healthcare movement. I deeply believe in this movement. And so today's going to be really cool. We've got some incredible thought leaders from across the spectrum. We've got amazing HR leaders that have done incredible things in their career. We've got folks talking about how you moneyball your healthcare spend and save money on innovative plan design. We've got really cool technology partners of ours that are in the room talking about how we move the ball forward with technology combined with consulting. It's going to be a lot of fun. And also, this is a really special day for Nava because we are announcing the biggest product development launch in our history. And we'll get into that in a few minutes. And so I've got one challenge for everyone in this group, though. I think a lot of you don't know each other, but a lot of you got to this room for similar reasons. So my challenge for this group is lean in this afternoon. Like, introduce yourself to 3 or 4 or 5 people that you've never met before and just ask the question, what got you here? And I think you're going to have some really interesting answers. You're going to come away, I think, with ideas. I think you're going to come away with agency around what we can all do together to make things better. So that's my challenge. And I want to introduce you all to Nava a little bit. Some of you don't really know Nava very much. And this is what we're all about. So we started Nava to fix healthcare. My co-founder, Donald, he's a cancer survivor. I've got my own healthcare journey story that got me to the front door. Kareem, our third co-founder, has his own story. We started Nava to fix healthcare. And I know how audacious and big that idea sounds. I know how motherhood and apple pie it sounds. I'm reminded every day. I wear this thing tattooed on my chest half the time. My team makes fun of me. They say, like, the only clothes you ever wear are like Nava Fix Healthcare swag. And I'm like, you got to wear the mission. You got to wear the mission. But my why, and what really gets me up every morning to do the hard work that we're doing to build Nava, and it's hard work because healthcare sucks, right? It is tough. I think we're all in the same room because it's tough. My why is this right here. It's about serving the people that we love. These are my 2 kids. This is baby Rose. She's 3 months old. That's her big sister, Nora. She's 3 years old. And I think every day about how do I build something that makes their life a little bit better, the lives of the people that I love. And I think about the people that you love. How do we make their lives better? How do we make healthcare work just a little bit better for them and their kids? And that's really what animates me, and I think everyone at Nava who joined the mission and joined the company. I'm going to start with a question. Who is the most important change agent in fixing healthcare? Any answers? What do you think? Crickets. I see some ideas. No one wants to say it. So we have a thesis. This is a question we asked ourselves a lot when we were starting the company. And we formed a pretty strong point of view that the answer is you. It's HR leaders. And HR teams around the country. And I want to make a case for why you are the most important change agent in fixing healthcare. HR is the front lines of healthcare in America. You're the healthcare buyer for 150 million Americans. Last year, you spent $2.5 trillion on healthcare and benefits across the community of HR leaders and employers. When we think about the sort of hero journey of fixing healthcare, we think about HR as the hero in that hero journey. And that really guides the way that we think about Nava's role in this. How do we augment, amplify, supercharge the hero, you, HR teams, in this hero's journey of building better healthcare plans, building a better member experience, helping employees get the questions answered that they need to get answered. And when it works, you guys make magic. This is a really cool quote. So Whitney Stuckey, she runs HR at a client of Nava's called the Paskin Group. They finished an amazing renewal. They dropped healthcare costs by 10%. We guided them to a really cool strategy. She said employees were able to upgrade their coverage because the savings made it more affordable. It is so rewarding to see them get the care they need at a price that makes sense. These are magical moments where every single employee sitting in that open enrollment meeting was like, slow clap. Thank you. Thank you. And these moments are amazing. And this is just one of the hats that HR teams has to wear. How do you build a healthcare plan, benefits plan for your employees? But the challenge is, it's just gotten way harder to make those magical moments. And there's some just structural headwinds that we're working against that make it so tough. We've got spiraling costs. Healthcare costs have gone up 100% in the last 10 years. Benefits in healthcare is now the second largest financial investment that every single employer is making behind their people. It is an absolutely consequential financial decision today. There's an absolute explosion in complexity. You've got hundreds of plan options and permutations. You've got dozens of new vendor categories, vendors to review. You've got myriad questions coming from your employees across all the different corners of the healthcare ecosystem. You've got compliance risks up and down the wazoo, and then all sorts of things in between. So like every vector of building and running a benefits plan in today's world has gotten 10 times more complicated. Systems, options, questions, et cetera. And then at the same time, you, HR teams, are being asked to do more with less. That classic DM, do more with less kind of acronym that we've heard over the last couple of years. We've got shrinking resources. And a stat that kind of blew my mind is the employee to HR ratio over the last 10 years has basically doubled. So HR teams are just being asked not only to wear more hats in a more complex arena, deal with a more complex healthcare system, but also to serve more employees better. These are tough sort of structural trend lines. And the way that we think about the benefits broker is we are your co-pilot in healthcare. That's how we think about it. And when I say that, what I mean is we are the guide to healthcare innovation. We are the ones that are meant to connect you to that latest vendor, that latest strategy that can help you deliver benefits at lower cost, help you get healthcare into the hands of a part of your population that hasn't had access to it. We are the partner with you in building and designing that health plan, from contribution strategies to vendor mix, and then administering that, rolling that out into your population, making sure they actually understand it, making sure it actually works. And then we are a powerful advocate for employees and their family members, given our position in the market, control that we have over the vendors, understanding we have of the plans themselves. This is what got us so excited about building a new kind of benefits brokerage and really reimagining it because of how much power we actually have to do good and to support you in that fixed healthcare mission and the HR superhero. What really gets us fired up, though, is that the traditional benefits brokerage industry is like stuck in pick a year, 1986, 1992, 1984, I'm not totally sure. But what's wild about this is those spreadsheets right there are analysis and insights from Renewal presentations in 2024 from the largest brokerage firms in the world. Don't look at the numbers, they're pretty ugly. And I think the thing that is so true today is HR teams are having to contend with more complexity, but the guide, the co-pilot that they have is relying on the same sort of technology and underlying operating system to support them that they were doing 20, 25, 30 years ago. It's literally the same spreadsheets. And this is collapsing under the weight of that complexity and all of those trend lines. And I think that manifests in very real, practical pain points that our customers feel. It's like, why should it take 2.5 days to tweak a contribution strategy from 5 to 10%? That's wild. My CFO is trying to get it like yesterday. You're sitting there looking around, spending 2 to 3 hours trying to figure out like what someone's GLP-1 coverage is on their like HCHP plan. That kind of sucks. You shouldn't have to take 2 or 3 hours to do that. You're hunting around for the latest version of the Renewal presentation through emails and all this stuff. It is death by 1,000 cuts of complexity and slowness that is making it harder and harder and harder for HR teams to really win at building healthcare plans and supporting their employees. And so at the same time, so we've got this trend line. It's 1985 in the benefits brokerage industry. At the same time, we are in the midst of the most significant technology shift in our lifetimes. This is bigger than the internet, folks. AI is rewriting the rules of what's possible. It is going to change everything and every corner of business, of society. And I want to show you, I want to describe that chart on the right. So this is the test scores from AI systems on a bunch of sort of human capabilities. So from reading, speech recognition, et cetera. That horizontal line is average human competency, like average human competency. So AI has already sort of like crossed that chasm above and to the right. And this was as of 2023. Things are just getting better, faster, and faster, and faster. And what we think about this is we are in the midst of the biggest technology transformation we've ever seen. And it's going to change everything about what's possible, what we can do, the services that we can deliver, the leverage that we can create. And so when I think about those two sort of opposing forces coming together, there's a quote that I just love. I think about it a lot, which is, it's a Hemingway quote. It says, change happens slowly, and then all at once, all of a sudden. And I think it's funny because I was talking to an HR leader recently, and she's like, I was like, describe your brokerage experience. And she's like, have you ever seen the movie Groundhog's Day? It just cracked me up. And she's like, Groundhog, sort of nothing changing, right? Like year after year after year. And I think we are sort of at this moment where you've got a confluence of spiraling cost, crushing complexity, and then this tectonic shift of technology that enables entirely new solutions to problems that have existed for a long time. And what's going to happen is that change is going to happen all at once. We believe that. We are betting on that. Nava is building a company around that change. We aim to be that change. We are building the new co-pilot for HR teams to help you win at healthcare benefits, employee experience. And we're really, really excited about it. And this kind of happens to every major industry. We think this is the Netflix moments for benefits brokerage. It's, Blockbuster was winning the day for a long time, and then something changed. And I am hell-bent on making sure that that is true. So I want to talk a little bit about Nava. Nava's strategy is actually not very complicated. It's a really simple one. Don't tell MMA, but our goal is to pair the industry's best benefits consultants and service professionals with powerful, powerful technology that delivers better service more completely and more efficiently. That's what we're doing. I think that's what we're going to be doing in 20 years. How do you bring the best human capital from Sequoia, MMA, Mercer, et cetera, bring them together, and then supercharge their efforts with cutting-edge technology for them and for the HR teams that they serve. And we think that's going to create magic over time. And I think I really want to double-click on the talent. I deeply, deeply believe in the human connection in healthcare. It's the most consequential sort of moment of almost anyone's life is when they have a healthcare emergency. And so we deeply believe in the importance and the power of that. And I think what I would say is, if you talk to any Nava nut, any employee at Nava who's wearing a Fix Healthcare t-shirt, they tend to share two common traits. They came to Nava because they believe the healthcare system is broken. The employer-sponsored healthcare system is broken, and they also believe we've got to do something different if we're going to fix it. And so that's what animates us, brings us together. And we're early in this journey. We actually just celebrated our 5-year birthday. We just hit 5 years. That's exciting. I'm very fired up about that, by the way. And we're making real progress. We now serve over 70,000 members, over 600 employers. We're growing super duper fast. We've got a lifetime net promoter score with the HR teams that we serve of 89. That is exceptionally high. Apple's is like 74. We're now the #1 benefits broker in our category. We've got an average customer score of 4.8 out of 5. And this is the thing I get so fired up. Our members, the employees, they rate our member support and our advocacy team and the Nava Benefits app a 97% member satisfaction with the interactions that they have with us. And so we're making progress, and we're creating super fans. I live for anecdotes. I love stats, but I live for anecdotes. Most helpful team I've worked with in my 15 years. Simply the best. 5 stars. I love this stuff. So we're doing it for HR teams. but we're also doing it for employees. And I think this is a super cool quote from one of our just members at one of our clients. She said, "I appreciate you treating me like an actual human with a real life on the line instead of a number in a spreadsheet. It means so much." This is after we helped her get access to very important healthcare that was being blocked by a jerky carrier that we had to go and elevate. And we think a lot about how do we take those moments, those anecdotes, and scale them from 70,000 members to 7 million members and beyond. That is the ambition that we have at Nava. If you're a Nava client in this room, maybe raise your hand. I'm just curious. We got so that is, yeah, round of applause. This is cool because we got a lot of non-Nava clients in here too, which is really neat. If you're a Nava client, it is my commitment that we will always relentlessly pursue that ambition. And if you're not a Nava client yet, it is my commitment that we always relentlessly pursue that ambition. And today is a really cool moment because we are going to take a really big step forward in manifesting and making true our technology vision in support of our mission. And so I'm going to bring up my co-founder, Donald. He's going to come up, and he gets to do the fun stuff, the product and technology demo. So Donald, come on up. Give him a round of applause. And I'm going to hand off to Donald, but I think I'll say just one last thing. This is the biggest product and technology launch in the history of Nava. I think this is the biggest product launch in the history of benefits, but you guys get to be the judge. So Donald, don't screw it up.
Thank you, Brandon. Ooh, thank you, Brandon. I have already lost my voice, which is a bad sign given how much talking I expect to do today. So let me grab one of these cough drops. I am Donald DeSantis. I'm the co-founder. I'm chief product officer. That means I am responsible for leading the team that builds all of Nava's product and technology. But the way I really think about my role is in the context of this mission. And it's building the Fix Healthcare Toolkit together with all of you. And we've been doing this for years now. We spend a lot of time speaking with Nava clients, Nava advisors, and people who are not, I like to think of them as like future Nava clients, to go, what are the things that you need to better serve your employees? And about our first real thrust here about a year and a half ago was the Nava Benefits app. The first app that combined so many powerful different features into a single platform for employees. So decision support to help them choose the best plan for themselves and their family at open enrollment. Provider search, ID cards, real-time deductible usage, and a team of benefits advocates that they could reach out to. That when Brandon was talking about somebody getting access to care, that was the team that they were working with. People love this app, it turns out. There we go. So this is actually a fairly recent quote. This is just from our internal Slack. And one of our newer clients, they're a large ed tech startup. They're about 1,500 employees. The HR professional, the HR leader there said this was like the best app she ever used, which is amazing. Like I am never gonna, this is gonna be a tough quote. I'm gonna be using this for years now. But that also employees had sort of proactively reached out and said, oh my gosh, where did this thing come from? It's awesome. So this was our first big thrust. We released this about a year and a half ago. But last year, we started talking with the HR community. And we said, what is the next big thing that we should add to the Fix Healthcare Toolkit, the Fix Healthcare technology stack? And we heard a few things. The first was, look, just make it easier to find all of my benefits information, whether it's the plan summaries, my employee elections, a random wellness flyer from the carrier. All of this stuff is spread between my network drive, my downloads folder. I spend way too much time looking for this and figuring out if it's the most up-to-date thing. I said, cool, I think we can do that. That sounds good. What else? Thought about it, had a lot of discussions, but the next theme that we heard was the renewal process. We're like, look, we want to look at more renewal options and we want to see them faster. Too often this feels reactive. I can't really tell if I'm seeing all of the options that are available to me, and the process is just so slow and cumbersome. Okay, that one's a little bit more ambitious, but is there anything else? Is there anything else that we could build for you? Is there anything else that we should think about adding to the Fixed Healthcare technology stack? And sort of like, this is a weird one, but what I really need is an AI strategy for my CEO. And the reason for this, we're like, really? Tell me more. And the reason for this, we heard various forms of this from different people when we had this conversation. They said, look, shareholders are asking boards, what is the AI strategy for your company? How are you going to navigate this change? Boards are asking the CEO. The CEO is asking all of their respective department heads, including HR. And HR, these people that we're speaking with, the HR professionals we spoke with, they said, look, I don't really have a good answer to that question today. And it's especially hard for me in HR, given how much PII and PHI that we're touching on a day-to-day basis. It's like, if you could give me that, that would be really powerful. So make it easy to find benefits information, streamline the renewal process, show me more options faster, and give me an AI strategy for my CEO. These are very different things. And the truth is, we had a really hard time trying to figure out which one of these we should tackle next. So we sort of threw our hands up in the air and said, we're going to do all of them. And this is what we're announcing today. I'm very excited about it. This is Nava's all-in-one AI-powered benefits platform for the HR community. This is the next big step forward in the fixed healthcare technology stack. And it starts, the cornerstone of this is a powerful, secure AI benefits assistant that knows about employee elections and all of your plan information. The next thing is a totally reimagined renewal experience that lets you look at however many renewal options you want. You can get in there, you can ask questions and get answers quickly rather than waiting for hours or days to go by to answer a simple question about the differences between two plans or what happens if you change contributions. The third is pulling together all of the benefits information into a single place. Benefits guides, wellness flyers, 401k information, all of that stuff in a single place. You never have to look for it. You never have to worry whether or not it's the most up-to-date version. And then last, bringing the app that we've already built with this amazing member experience onto this platform so we have just one unified thing. There's no additional setup, there's no additional configuration, there's no trying to reconcile data or the elections across the board. One single place for all of this stuff to work together to make it easier for HR teams to support their employees. We are calling this platform HQ, and HQ is designed to augment and really supercharge the relationship, the working relationship that you have with your benefits consultant, your broker. If it's okay with you all, I would like to show you a few of the features. Yes? Yes, okay. All right, let's do it. Also, by the way, if you haven't figured out yet, this is Nick. Nick is one of Nava's best client managers. He's amazing, and he's also an amazing photographer. Look at him over there, yeah. Okay, let's dive into some of the features of HQ. This is HQ. The cornerstone of HQ is the powerful AI benefits assistant. I know we have a lot of folks who are quite senior in the room today, but there is probably somebody on your team who spends most of their day going back and forth with employees and carriers and Cobra and your broker. And if you sat over their shoulder and watched how hard it was for them to do their job and how long it took them to accomplish the tasks that came into their inbox, you would probably be horrified. I'm speaking as somebody who has observed this directly myself. I'm like, oh my gosh, we have to fix that. So let's take just one example right now, which is a relatively simple question that I think is illustrative of what many HR professionals are receiving today, which is, does some employee, I think in this case Daniel Roberts, does Daniel Roberts have access to GLP-1 drugs? Now, to answer this question, you actually need to go into the benefits administration system, see which plan they're on. You have to pull the plan summary. You have to go find the pharmacy formulary, which you might not even have, but if you do have it, if you ever looked at one of these things, it's like 250-page PDF. It's 8-point font. It's terrible. And that doesn't even tell you anything about any pre-authorizations or prescription limits, fill limits, anything along those lines. So what happens if we ask HQ this question, which has all of this information loaded into it? HQ is going to look at all of those documents for you, and then it's going to give us an answer, which is, yes, Daniel Roberts does have access to this with a handful of things, including, well, it's going to scroll past me, but including a pre-authorization, including some fill limits, and some other things. And you can take this information, it's also citing right there the file that it's using, so if you want to pull that up, you can see the underlying file and data that it used to answer this question. But you can also ask it, great, can you put this into an email that I can send back to Daniel? And it will do that. It will take this information here, it will say, hey Daniel, here's the answer to your question, here's how it all works in gratuitous detail, and it's very easy. Just hover over copy, click copy, it copies it to your clipboard, paste it into your email client. you're good to go. This probably would have taken, if someone was a benefits expert on your team, this would have taken them hours to do, but more likely, they would have emailed the broker would have spent hours doing this, and it would have been days to get a response back to Daniel. Now this just took moments. So what else can HQ do? HQ knows a lot of different things about a lot of different things. One of those is compliance. So let's say we have an employee who is thinking about moving to New York, or maybe we had an employee who we just hired in New York, and we're wondering, what are the New York-specific compliance things that we need to be aware of? Now again, HQ knows how many employees you already have in New York, which might be relevant. It knows about your plans, which is definitely relevant, and it knows everything that needs to be known about New York State's and New York City's local compliance regulations. So when we ask HQ this question, it looks through all the information that it has, it searches the web if it needs to, and it tells you everything that you need to know about a new employee or an existing employee who moved to New York. You can also ask HQ to build you a to-do list if this is you who's going to actually be doing all this work, or to build a project plan if you need to send this to somebody else in your team for them to do. This is very cool. I don't think anything like this exists right now that is totally secure, that has all of your benefits information, and knows how to navigate across all of your plans. You might offer 5 different medical plans, 2 different dental plans. HQ knows how to connect these dots because we've put in the work to connect them all behind the scenes. Let's talk about the renewal side of things. This is very exciting. And again, what we've heard from HR professionals, you saw this with Brandon a moment ago, the spreadsheet that a benefits consultant is given today when they start at a large brokerage is the same one that was probably used 20 years ago. There just hasn't been innovation here. And as a result, it's just become harder and harder and harder for HR professionals to get to the best answer quickly for them when it comes to their employee benefits plans and their renewal. So this is how HQ handles your renewal. On the far left, we can see this is your in-place renewal today. Your current premiums, and then broken out by the employer share and the employee share. Down below, we can see all of the plans that you offer, as well as how many employees are enrolled in each one of those plans. Then off to the side, we can see these are all of the options that your consultant has put in for you, with the existing in-place renewal, if you change nothing at all, to a different contribution strategy, to a level funded strategy, to a carrier change, and even a self-insured strategy with Pareto as the captive here. So this is a great high-level view of what the options are, certainly better to use than trying to parse this in a spreadsheet. But obviously the devil is in the details when it comes to decisions like this, and HQ makes it very easy to dive into those details. So we're able to compare these plans, and so what we're going to do here is compare the high PPO plan against the Cigna high and low PPO plan to see the differences. And we can choose any combination of plans that we want, and it's going to pull these together in a single place so you can see them side by side. Now this is pretty cool, and this is definitely better than the spreadsheet, but the problem with this stuff is it's very hard to tell the difference between are these changes good or bad? Where do the changes actually exist? Sometimes if the number is higher, it's better. Sometimes if the number is higher, it's worse. And sometimes there's a whole sentence that's stuffed into these boxes, and you have to read the whole thing and try and parse it. So again, HQ is an AI-powered benefits platform. So we've used AI to actually go through and understand what all of these things mean in the plan designs, and then highlight contextually for each one of these plan attributes whether things are good or bad. And it's a little washed out on the screen right now, but it's going to highlight them red or green, so you can actually see which things are better or worse in real time across any combination of plans that you want to select that your broker has put together for you. That is not all, though. This one I'm very excited about because I heard the signal on this one was absolutely so strong. I bumped into Kara earlier, and I don't know if there's anyone else in here from People Tech Partners today, but we spoke with a lot of folks from People Tech Partners, and this was one of their most requested features, which is around contributions. So maybe a question, little crowd participation. Have you ever brought a renewal to executive stakeholders and presented some renewal options and been asked, hey, what if we change the contributions like X? Has anyone ever had that experience? Anyone at all? Okay, about half of you. The other half, I need to have some of what you're having. This is the frustrating part about a question like, hey, what happens if we tweak the contributions like this, is that on its face, it's a totally reasonable question to ask. The problem is, it's just really complicated. You have to dive into the spreadsheet, hope that you don't break it. You're definitely probably not going to do that in the meeting in front of all these other executive stakeholders. Or you go back to your broker and you say, hey, can you answer this question for me? And that might take a couple of days to turn the answer around to that question. In HQ, this is what it looks like. The first thing that you would do is go up to any one of these scenarios, any one of them, and click on Edit Contributions. That's going to pop open a screen like this. Now, you can do this live with your Nava consultant, or you can do this on your own if the CEO or CFO asks you a question like this. So you can change the contributions right here. In this case, it was shifting the employer contribution from 95 down to 90 and then 90 to 85. You can also do this on any slice for like a plan, for an employee class, employees in different states. Super easy to do. And then what that does is it updates this in real time, so you can see right there what is the difference if we change the contributions. And you don't need to say, let me get back to you in a couple days, or that's a great question, but we really need to make a decision today. We don't have time. We don't have time to get the answer. The last thing I want to show you on the renewal side is real-time employee demographics. So your renewal, yes, it is about this year and what is the best renewal for us this year, but a great renewal strategy is one that's sort of setting the table for what the next 2 to 3 years look like. So you might have questions like, what sort of ages are our employees? Do we have a lot of people in our 20s and 30s? Should we be expecting a lot of people to be starting families over the next couple of years? Should we be thinking about IVF and other benefits in our plans? Should we be considering programs like Maven and Carrot to help support them, but also control costs and high claims hitting the plan as we go forward into these next renewal seasons? Do we have are we missing a lot of enrollments on the HSA plan, especially among younger employees? Maybe we should look at our contributions. Maybe we should think about having a session with our employees on how those plans work and why they might be a good option to them. All of those things are here at your fingertips in real time as part of HQ. So that's a lot. All of that is going to be able to demo. You saw the computers outside in the reception area. Curtis and Dylan will be able to demo this for you. Curtis and Dylan have actually been working on these products. Yeah, they're in the back. They have been building these products. So you're going to be speaking with the people who are building this. And again, this is really how Brandon and I think about this. Like, we're building together with the HR community the fixed healthcare technology stack. So you're going to be speaking with the builders directly themselves, and you'll be able to look at everything that we just looked at. But we have a few things that are coming over the coming months, and I want to give you an insight into what that looks like. The first is employee engagement. And this starts with engagement on the Nava Benefits app. How many of our employees have downloaded the app? How many support requests and support tickets have we received over the past period of time? What have been the categories and nature of the questions that they've been asking? And how satisfied have our employees been with the results of those questions and the service that they're getting? The next thing is benchmarking. So pulling together the largest data sets nationwide into a single platform where you can, throughout the year, compare yourself to similar companies, drilling down to companies like yours, comparing things like out-of-pocket maxes, deductibles, contributions and cost sharing, and so much more. The last one I'm very excited about, this is a much requested feature, carrier bill audit. It's probably the biggest boogeyman in benefits, which is the knowledge that somewhere there is an employee who thinks they have health insurance, but don't because the enrollment was messed up somewhere, or that you're paying for an employee who no longer works at the company and are not gonna be able to get those premiums back. You probably have somebody on your team who periodically today is reviewing carrier bills. It is like, if there is a seventh circle of hell, it is probably just a giant stack of carrier bills and employee census files. Nava is building carrier bill audits directly into the app. This is a service that we already offer to our clients today, and we've built a lot of technology here, and there's a lot of prior art, but we're bringing that directly into HQ so that any HQ user can just upload a carrier bill from any one of the carriers that you have and be able to instantly get a report that tells you under-enrollments, over-enrollments, or other errors, maybe in terms of premiums or how much the employee is being charged. And then you can work with your Nava consultant on reconciling those. All of this sits on powerful integrations. As part of building the Nava Benefits app, we have for years now been working through all of the Ben admins out there to get really strong integration coverage. Today we have dozens of Ben admins that we have integrated against and are setting up every single day. It is very unlikely that you are on a Ben admin that Nava does not support. But the biggest thing that we've been working on is trying to make it easier and easier and easier. How do we take the time to set up a new client and to build that integration from weeks to days to hours to, the dream, of course, is instantly. And I'm really excited to say that we've actually done that now in close collaboration with a company that we're a fan of. We've been working with a lot, and that company is Rippling. And I'd like to show you what this looks like. Because integration, setting all this stuff up is some of the hardest parts. Like you probably EDI feeds and SFTP feeds and all this other stuff. That's probably the sixth circle of benefits hell. So if you're a Rippling admin and you've ever been to this screen, you can see that you can add a new app into Rippling right here. There are all sorts of different Rippling apps in their app marketplace. And if you go now and you look, you can see Nava in the Rippling app marketplace. And all you need to do is click connect. And when you click connect and then go back to your admin screen, you'll see Nava installed. And your employee census files are now automatically making it to Nava. That's it. That's all you need to do. I was not pausing for applause. That probably seemed really corny for me. I just heard you exclaim. I wanted to make sure that you're okay. So excited. She lost her breath. Yeah. Okay, cool. Let's see what else we got. Last but not least, definitely security. Happy to talk more about this. Nava is SOC 2 compliant. HQ is HIPAA compliant. What we want to do is set you up that if you recommend HQ to your company, that we can go have a great, productive, and easy conversation with your IT team. We've done this a zillion times before, and we're very prepared to do that going forward. Let's talk about pricing, HQ pricing. So we've talked a lot about this internally, and excited to share this with you today. So for existing Nava clients, HQ is included, free of charge. HQ is included free of charge. Okay. For new clients, we're going to announce pricing in September on this. We're working out pricing right now. We think we've got a good idea of what it's going to look like. We're going to be announcing that in September. But for folks in this room, if you request a demo, you can do that at the laptops out there, at our demo stations. If you request a demo today, and if you sign up with Nava by August 31st, you will get the existing client treatment. You will be grandfathered in. HQ will be free. There won't be any charge for you when we announce that pricing in September. Cool. So I want to end where we started, which is just back on the mission. So it is very fun to get excited about all of the technology stuff that we're building and the AI this and the AI that. But again, this is really just part of the fixed healthcare technology stack. This is really all in service of the mission. I actually don't know who Mary Catherine D is, which is part of why I really love showing this. This is just, if you go into iTunes, you go into the App Store, you can see this review right now. I have no idea who this person is. We didn't ask her to say this. I don't even know what feature she used. I don't know what prompted her to say this. But something about what we were able to do for her as a result of her HR team putting us in that position was compelling enough for her to go to the App Store. I've had an iPhone since the first one. I don't think I've ever written an app review in the App Store. This woman went and wrote a review saying that she was blessed that the company that she works for rolled out the Nava Benefits app. So this is why we're all here today, and I think together we'll be able to create a lot more Mary Catherine D's out there.